It's the morning news, News Talk 1280 KIT. And boy, oh boy, we have had plenty of conversation over the last week, particularly by way of Lance talking about clinics for vaccines, where they're at, where they're available, who needs an appointment, who doesn't, all that sort of stuff. And we've also heard about the anxiety that has come from some folks about should I get the test or shouldn't I? We're hearing from CDC about whether we'll get to herd immunity or not, and all these other things. And so we thought, let's get some area expertise in on this. Dr. Robert Wenger is the Prosser Memorial Health's ED provider and emergency department medical director. So he knows what's going on, and he joins us this morning. Doctor, good morning. Thanks for being with us.
Good morning. Thank you for having me.
So, hey, thanks for you guys helping to sponsor our studio. Prosser Memorial Health is helping to provide a roof over our heads. So, Doc, thanks very much. We appreciate that. Be out broadcasting in our field if that weren't the case. So, thank you very much for that.
Prosser holding a COVID clinic tomorrow, right?
That's correct. Tomorrow morning, all morning and afternoon. We still have many spots open. Our goal is to get about 1,200 vaccines completed tomorrow. So if you're eligible and you're looking for a vaccine, please sign up, get an appointment. The reason we want appointments is really just to ensure that we have an incredibly efficient clinic. Our goal is to get people in and out the door as quickly as possible without really having to wait. The only wait time should hopefully be the few minutes you have to wait after the dose just to make sure you're doing okay. So please, if you're available and looking to get vaccinated, we're happy to help you out.
Go ahead.
I'll just say it's protocol, about a 15-minute wait then to see that everything's cool. Is that what you do?
Yeah, that's correct. About a 15 minutes. And really from what we've seen, we've vaccinated about 10,000 people so far at our clinics. Most people might just feel a little bit woozy after the needle injection. We really have not seen any more severe side effects like allergic reactions, but that's really what we're looking for, is just to make sure that if someone who develops a reaction, which is incredibly rare, that we have the right folks there to help take care of you and treat you for that.
Have we figured that if we, were offering a shot of Jack Daniels while you wait that time out, you might get more people to make appointments? Has that been considered at all, or no? No, Dave.
Maybe in the future. I think we'll recommend that to the
at least a conversation. It couldn't hurt.
It's interesting because I've done, like Dave says, I've done a number of these stories with Moderna vaccine, but you're the only one that I've seen the press release that says that Moderna vaccine, it's only been approved for those who are 18 years old or older. So
right.
So if you're 16, you shouldn't get it. You can't get it. You won't give it to them. What's the scoop there?
Yeah, so unfortunately right now the only vaccine that's available and approved for 16 and older is the Pfizer vaccine.
Pfizer. Okay.
The Moderna as of today is still 18 plus.
Okay.
It's likely to change very soon. There's studies being completed on younger and younger people, as we speak, to ensure the safety and to ensure that they're effective in preventing COVID-19. Just that those studies haven't been released yet. So other than Pfizer right now, they're the only ones who are able to vaccinate 16 years and over.
Moderna must be using an R-rated needle or something. What's that about? But, not the case.
I think Pfizer they just took a jump and they just really started studying it earlier, which is really awesome. Just to get as many people as possible vaccinated.
Yeah.
And we it's sort of a luck of the draw as to what batch of vaccines we get from the state. So right now the batch that we have is the Moderna. So as of right now, only 18 and older. But yeah, hopefully soon we'll have that vaccine available to not just 16 and over, but children going down to the newborn range, hopefully.
Dr. Robert Wenger, is it pronounced Wenger or Wenger?
Wenger, correct.
Wenger.
Okay.
With Prosser Memorial Health. Doctor, some people are, let's face it, we're in the news biz, and bad news is what makes the news. 20,000 shots going how they're supposed to, that's not the news. One person having a anomaly is what gets in the news, and everybody freaks out about that. And it's so unfortunate, and it's so disproportionate. It obscures the reality of things. What would you say to folks that haven't gotten a vaccination yet and that are debating it because of their general concerns? Is there any message that you might have to alleviate fears? I mean, nothing is 100% obviously, but what do you need people to know?
Absolutely. I mean, I think that's a great question, and we expect people to be concerned. We want people to make the correct, informed decision. We want them to feel comfortable with the decision that they're making. We want people to do research and to trust but verify what they're seeing and learning as well. I kind of see our role as physicians and in the medical field to look at the data, to look at the research, and to help interpret that and make it, put it into terms that are easily understood by the general population. But, I think at this point, we know for sure that the vaccines are exceedingly safe. We've had about 200 million vaccines in the country administered with really very little side effects. And I know there's a lot of discussion lately and a lot of hesitancy, especially related to the Johnson & Johnson vaccine with reports of blood clots. But I think we also need to understand that the blood clots are at just an incredibly rare rate of less than or about 1 in a million. I mean, you have more of a chance of picking up a lottery ticket on your way home from getting the vaccine and winning the mega millions than you do to develop a blood clot. But I think it almost really shows the success and how well the system is working because the CDC and the researchers have identified these extremely rare cases and have decided to do the right thing and put the vaccine on pause to make sure that we fully understand what's happening. And if it is related to the vaccines, that we can identify what we can do to prevent it going forward. So, as unfortunate it is that we've had to put a batch of vaccines on hold, and it's probably delaying, probably millions of vaccines a day. I think it really just goes to show how vetted and how safe the program is. And there's a whole team of researchers who are involved every single day looking at positive outcomes, negative outcomes, and making sure that we can continue vaccinating folks as quickly and as safely as possible.
Well said, Doctor. Some people say, look, I don't want to be a guinea pig. This stuff is, cleared for emergency use. It wouldn't be normally cleared at this time under normal circumstance, so I don't want to be part of the Petri dish. We're really past that, aren't we?
I think so, and although we'll speak briefly about the Moderna and the Pfizer technology, the mRNA technology. This is the first time that the technology has really been used on an actual virus to treat and prevent actual viruses in actual patients. But this technology has been around for 30 years. It's really nothing new. It's just been incredibly well studied up until now, but this is just the first time where the mRNA vaccines are actually effective in preventing disease. So it's our first opportunity to use it. And yes, things were sort of not necessarily rushed, but they were definitely expedited because COVID is such a dangerous virus. I mean, we're seeing a lot of people die. We're seeing a lot of people who don't die but become incredibly sick from the virus. So, it was certainly getting this vaccine out as quickly as possible. It was really our only hope and our only chance to get this pandemic over with and to get back to normal. So instead of, most of the times when they do clinical research, they do a phase 1 trial, and once phase 1 trial is finished, they start phase 2 trial, and then once phase 2 is finished, they start phase 3, et cetera, and things can get really drawn out. But one thing that they've done with this is they've just started all the trials, phase 1, phase 2, and phase 3 all at the same time just to get it done as quickly as possible. So from a trial standpoint, these vaccines have been studied as well as many other medications that are out there that treat, a variety of conditions that we take every single day without any question.
Sure.
Yes, we are still learning about things as for example, when blood clots, for example, for Johnson & Johnson are so profoundly rare, it's going to take 6 to 8 million vaccines to start to see a few. So yeah, we are still seeing, we're still actively investigating it. I would certainly not consider us guinea pigs, but also being aware that we're still looking into these vaccines and making that they're safe every single day.
You know, the vaccines, we know that they don't want to open up a package because you don't want to waste them and you can't use them after a certain period of time. I don't know if it's an effective expiration, but have we reached the expiration date on Dr. Fauci at this point? Do we,
I think he's got many years left.
Yes.
I think he's got a lot of criticism from both sides, but I think he's certainly a guy who I and I think many other people in the medical community look up to. I mean, he's certainly a smart guy who's got a lot of experience with dealing with the pandemic.